Joining me now is the owner of New Path Mental Health and Wellness, Zack Coco. Welcome, Zack.
Hey, how are you?
I'm good. How are you?
Good.
I'm glad to have you here with us today. In just a moment, we'll talk about the FDA-approved treatment for treatment-resistant depression. But first, for those who don't know, what is treatment-resistant depression?
So treatment-resistant depression is basically someone who has tried a few different oral medications for their depression, and they're just not getting the results that we would expect. They've tried maybe a few depression medicines, they've tried therapy, and they're just still feeling really depressed.
And that's where Spravato comes in. Tell me, what makes this so different than the traditional antidepressants?
Yeah, so there's multiple different options for treatment-resistant depression, but I like Spravato because it works really quickly. Usually oral antidepressants work on neurotransmitters like serotonin, norepinephrine, dopamine. Spravato works mainly on glutamate in the brain, which works really, really fast. So
I've never heard of glutamate.
So most oral antidepressants don't touch on it. So it's a newer method that psychiatry is really getting into. Usually oral antidepressants take up to a month to start working, whereas this can take a few days to a week.
Very quick.
Mm-hmm.
Well, what does a typical Spravato treatment look like from the moment a patient walks into your clinic?
So at the beginning, we have people come in for a consultation. So typically we'll schedule an hour, just kind of get to know each other, look at everyone's history, see what they've tried, medical history. Once we determine that they're a good candidate, we'll get the medication approved. They come back. Normally it's twice a week for about 4 weeks, then once a week for 4 weeks, and then we reevaluate. But each treatment is 2 hours at a time. We put them in a room, comfortable. We've got heated and reclining chairs, leather chairs. We try to make it as comfortable as we can. But they're sitting there for 2 hours, just relax, let the medicine do its thing, and then they can go home.
And there are a lot of safety requirements when it comes to using this. Tell me more about that.
So we are a registered treatment center for Spravato, so we've had to go through special training on how to monitor clients. There are obviously potential side effects that can happen whenever they're on it. The good thing is that typically only happens during that 2 hour window while they're at the office.
Yeah. And you have an eye on them.
You're right. So we monitor, we make sure, we're checking blood pressure, making sure that they're not getting too dizzy, too disoriented. If they do, there's things that we can do to help mitigate some of that, but it's just keeping them safe while they're getting the treatment.
Well, that's important, especially if you're trying it new for the first time.
Right.
For anyone out there thinking, this might be a good option for me, what steps should they take to get the help that they need?
We're not the only place. Obviously, I would prefer you call us, but you just call an office that offers it. There is a website, the Spravato website. They have a link for offices that provide it. Just give the office a call, let them know what you're needing. They'll set you up with one of our med providers. You can come in for that consult. Mm-hmm. We'll go over your options, whether it's Spravato or we also offer ketamine. There's other options that you can look at. You just work with your provider to decide what the best option is for you, and then we'll get the ball rolling from there.
All right, New Path Mental Health and Wellness. Where are your locations again?
So we have offices right now in Little Rock and Conway, West Little Rock, and then right now we're actually in the process of moving our Conway office, so stay tuned on that. Okay. It'll be a few months, but and then we're looking at potentially a few other spots right now as well. So
sounds like you're just on the grow.
Trying to.
Very exciting. Well, thank you so much for sharing more about that, Zack. We appreciate you coming in today.
All right, thank you.